Peace, Grand Risings family. It is your sister girl, Morgan Renee Myers, tuning in for another reading. This time, this is a special edition reading. I am in a fertility advocacy class through Facebook, and I kind of been behind on my studies. It's a self-study course, but we're supposed to write a paper. It's 3 books that we're assigned. We're supposed to write a paper of each, and there are different online modules that we take. So nonetheless, whether you are a returning subscriber or new, welcome and hello. I'm going to be reading this book. And for those that don't know that are new to this channel, I like to keep my second phone nearby so that I can use it as a dictionary, because I do like to look up words that I'm not familiar with if they're not, thoroughly explained or context clues don't bring them out for me. So let's just get right into it. This book that we were assigned is called Down There, Sexual and Reproductive Health, The Wise Woman Way by Susan S. Weed. So let's get into it. Has a bunch of different, as y'all know, sometimes I like to read the whole everything, but I'm not going to do that because it's pretty lengthy. But got part 1 for everyone: the pelvic floor, the bladder, trauma down there, the vulva, the clitoris, the vagina, the cervix, the uterus, the ovaries. Part 3, especially for men: the penis, the testes, the prostate, herbal pharmacy, yada, yada, yada. All right, here we go. The Wise Woman Tradition. This book speaks from the wise woman in me to the wise woman in you. Woe/man includes man, as you can see. It is based on the belief that we are capable of observing our own body, heart, and mind, responding to the messages we receive, and caring for ourselves in a context of loving support and assistance. The Wise Woman Way nourishes health. We live in the scientific tradition. It measures and fixes. It is covered by insurance, which is often called alternative medicine. Is the hold on, let me go back. I think I'm reading too fast. We live in the scientific tradition. It measures and fixes. It is covered by insurance. What is often called alternative medicine is the heroic tradition. It cleanses toxins from the filthy body, the dreaded colon, and the dirty liver. It runs on rules. The wise woman tradition is the oldest way of healing. It nourishes the wholeness and holiness of the unique individual. It trusts the body's wisdom. Wise woman healing comes in cycles, adjusts to the seasons, moves in spirals, listens for harmonies, dances in rhythms and resonances with flexible strength. Wise woman healing focuses on nourishment, whole, healthy, holy food and rituals, creating whole, healthy, holy beings. Wise woman herbalists, and that includes you, gather and prepare each leaf, each root, each berry with respect for its symbiotic wholeness. They seek simple, safe, local herbal remedies that have been tested in many situations and with a wide variety of people. May this book guide you. Wise woman healers, and that includes you, share what they know. They trust the careful experiments and the colorful experiences of generations of ordinary and extraordinary people. Herbal medicine is people's medicine. This book is my gift to you. Ooh, she got me excited. Okay, I want to be a wise woman. The wise woman inhabits our dreams, our visions, and our deepest memories. She speaks to us as grandmother growth. Her beloved consort, grandfather growth, accompanies her. She is the crone, she who holds her wise blood inside. She is a shaman. She is Baba Yaga. She is Kuan Yin. She is Kali. She knows the healing songs of the plants. She dances the heartbeat of the earth. She holds out her hand to you. Do you hear her singing? Do you feel her? Take her hand. Come. Okay. So, I like that. That was nice. Introduction. My mom loved bragging about my birth. She was out playing softball until 4 hours before she pushed me out. She told me, birth is normal. Birth is natural. There's nothing to fear about your body. There's nothing to loathe about your body. Your body works perfectly. Trust it. Such a priceless gift from my mother. In Down There, Sexual and Reproductive Health, The Wise Woman Way, Susan Weed offers each one of us a similar gift. The The story she weaves here, as in her previous books in the Wise Woman Herbal series, is one of deep healing for women and men. Down There, the Wise Woman Way tells us stories about healthy cervixes, healthy uteri, healthy yonis, healthy penises, healthy prostates, and healthy sex. Down There brings us into a healthy relationship with our bodies and enlightens us about the places where, for too many, the sun never shines. Down There teaches us how to restore health when we are in distress, how to stay healthy, and how to relinquish fear and embrace pleasure. Down There helps us reconnect with the healing plants and reminds us to connect our health with the wealth of our planet. I know Weed's compassionate words will reach deep into your painful places and help heal them. I believe that Weed's stories can replace your stories of illness with those of healing and trust. And I am sure that the remedies gathered here will help you avoid the medical profession's ever-expanding search for disease that leads to screening tests, followed by invasive tests and treatments that lead to new symptoms, new scars, new fears. Before and after you go for screening, read this book. Before you follow the doctor's advice, read this book. Before you agree to a hysterectomy or a prostatectomy, read this book. I bless this addition to the Wise Woman Herbal series. Congratulations on a fine new baby, Susan. Aviva Ram, January 2011, wrote that. As the intro, she is a midwife, MD. Okay, here's the foreword. Spring is showing off. Lilacs scent the breeze. Late tulips shelter shy violets. Bloodroot leaves unfurl. Creeping phlox paints the ground. And the celandine erupts in yellow and green sprays. I'm sitting outside, renewed by floral joy and cavorting baby goats, but only for a moment until I return to the computer, return to Down There, return to listening to grandmother growth. There's no moon tonight. Make ready, make ready. So she has these different italicized versions that don't make much sense to me. I had started reading it, and I guess it's either from a song or she's just trying to include some poetry. So if it don't make sense, it don't make sense to me either, but I'm going to read it. So before I return to Down There, return to listening to grandmother growth. There's no moon tonight. Make ready, make ready. The moon is dark tonight. Get ready, get ready. Every woman goes to the moon cave tonight. I've been working on Down There since 1965 when I started collecting information from books, articles, and listening carefully to thousands of practitioners, doctors, and ordinary people talk about Down There. I met Betty Dodson. I attended Annie Sprinkle's sacred sex workshops for 10 years, then taught them for another 10 years. I thought about and questioned the accepted reasons and remedies for Down There distresses. Get ready. Hold my hand. Get ready. We go. The stars burn holes in the sky. No moon softens their edges. We go. We go. Hold my hand. We go. We all go to the moon cave to bleed, to share wisdom, to tell stories. We go. In the deep memory of my womb, in the recurring stories of my ovaries, in the molten moist folds of my vulva, in my orgasms, I sought answers. I synthesized and enlivened what I had ingested. I sought the safest, simplest ways to heal the enormous energies of the pelvis, to maintain and regain continence, sexual entrance and pleasure, and a host of other Down There topics, all the while opening my heart and dreams to grandmother growth. Singing, striding, together we go. Singing, we go to the moon cave. Singing, striding, climbing, we go to the moon cave. Singing, I would sit and sing. Help me, grandchild, sing with me. Sing the moss under my bones. Sing to me, then sit by me. We will sing the beads onto the moccasins. Sing the reeds into a basket. Sing the herbs into allies. We will sing moon cave songs, blood songs, birth songs, womb songs. I get enraged by medicine that believes frightening millions of men into useless, often harmful screening tests in preventative medicine. Mammograms, colonoscopies, PSA tests, and pap smears don't prevent anything. Do they allay fear, or do they feed it? Can we be healthy when we are anxious and fearful? Fear makes me gullible. It clouds my ability to choose wisely. Instead, I wish to choose to care for myself rather than to react from fear. I want to know all the facts so I can decide for myself what to do, helped by inner knowing, not lashed by desperation. I'll sing you the song my grandmother's grandmother sang when she was in the moon cave. Can you feel her in these rocks? Can you taste your ancestors in the water? Open yourself to their pleasure. Think happy thoughts. Feel good in your body. There's sex in this book. Like Wilhelm Reich, I believe that healthy organisms need healthy orgasms for optimal health. May this book lead you to the orgasms you want and help you to want them. May this book help you feel good in your body. May it show you how to reclaim the pleasure in your pelvis. Feel into your body. Feel into the spirit. Lean against me. Allow your feelings to emerge. Lean against me and sing. Sing yourself to wholeness. Sing yourself to joy. Let the ancient ecstatic music move in you. When we reconnect with the earth and with each other, we can hear each other's story. We can hear the wise woe man within. We remember our power. We understand that our health is in our hands, not in those of the experts. We claim our right to decide how we heal. We value our intuition. We trust our own hearts. Some topics I did not want to include in this book: female genital mutilation, male circumcision, and pelvic trauma. Nonetheless, I did. Other topics such as HIV and AIDS, ambiguous genitals, transsexuals, and gender identification issues I have not included, though I have done my best to be aware of them and to reflect that awareness in my writing. This book is yours now. May it empower you on your journey of health and healing. May it lessen your fear, feed your wholeness, and help you manifest a healthy, joyous, orgasm-rich life. The moon is silver sickle. We go, we must return to duty, to caring. Savor your memories, granddaughter. Remember joy. Keep your heart open to the old truths. Take my hand. Let's go home. Susan S. Weed, Laughing Rock Farm, May 2011. All right, so we about to get into it. That was all the intros and whatnots. And I'm going to read the 6 steps of healing, but first I'm not going to do too much of this since I am reading for people that may be tuned in from my course. But I just want to say that just whole intro was super empowering. I personally do not trust doctors. I have had an incident where I was no longer able to go to my gynecologist because I didn't pay my bill or something like that. So they kicked me out the office, and I needed a colposcopy for my last pap smear with them. So I went through a program through my local hospital, and it just was not a great experience. They left, what do they call, the stirrups or whatever that clamp is they put in to open you up. They left that in me for like over 20 minutes while they were still running around trying to figure out what materials and stuff they needed. So I still don't even know the results from that colposcopy. I just have not been rocking with doctor since. And just where I'm at in my personal journey, where I'm living a mostly plant-based lifestyle. I slip up every now and then, have some cheese or some eggs or something, or piece of chicken or something. But overall, I'm mostly just consuming plants. But I desire to learn more about herbs. I desire to get back to my ancestry, get back to what we knew, because we do have to be protectors of ourselves. We have to be knowledgeable of ourselves. We put too much of our time and energy into just believing what the doctors say. And I did a post on my Facebook and I asked how many Black people in America trust doctors. A resounding no. And some people came on there being all extra intellectual, like, yes, I do trust them. I trust them to, tell me what they know based on what they learn. But if you don't know, most doctors are not really trained for healing. They're trained to prescribe you things. So yeah, it's not like Eastern medicine, you go over the seas and like they're more into the herbs and the actual healing. So it's time to get back to that. That's where, especially if you're of African descent, or melanin, native, whatever, indigenous, any of that, we are known to know about the medicines and the healing. So that's why sometimes they try to paint a picture that like people that are into all of that are like, real witchy or whatever. And in a sense, maybe they are, because they know how to make magic and take these herbs and formulate them and turn them into things that are healing for our body. And these are things that we need to know. So I've said enough. Let me get back into the reading. All right. 6 steps of healing. Parentheses suggest a few of the modalities of each step. Okay, so step 0 is do nothing / serenity medicine. So sleep, meditate, unplug the clock, don't look at email. A vital, invisible step. Listen to the voice of the wise healer within. I like step 0. Step 1, collect information. story medicine. Low-tech diagnosis, support groups, books, dreams, divination. We want to know why. Listen to the voices of the wise healers without. Okay, so the first one was a wise healer within, wise healers without. Step 2, engage the energy / mind medicine. Prayer, homeopathy, visualization, ritual, laughter, Reiki, placebos. This is the shaman's playground. It is flashy, colorful, scented, lush. Here we will it to be so, and it is as we will, with harm to none. Step 3, nourish and tonify / lifestyle medicine. Nourishing herbal infusions, food, movement, yoga, tai chi, walking, moxibustion, tonic herbs. We create ourselves with every choice we make. The first 4 steps build health. Engage them daily. So all of these things I just mentioned, they build health. Engage them daily. Now these next 3 that I'm about to read. Step 4, stimulate / sedate / alternative medicine. Acupuncture, chiropractic, naturopathy, herbalism, hydrotherapy, massage. A good place to start when dealing with a chronic problem. Tonic herbs are safer than drugs. Bring that a little closer. All right. Tonic herbs are safer than drugs, but overuse can lead to dependency. Get this lighting together, honey. Step 5, use drugs / pharmaceutical medicine. All prescribed and over-the-counter drugs, all supplements, essential oils. One of the leading causes of death in America is reaction to prescribed drugs. I just saw a chart on that the other day that like the 3rd biggest cause of death is medical malpractice or like mistakes. I was like, wow, goodness. Step 6, break and enter / high-tech medicine. Surgery, MRI, CAT scans, x-rays, injections, colonics, psychoactive drugs, invasive diagnostic tests. Side effects may include death and disability. Think twice about invasive screening procedures such as mammograms. The last 3 steps are fast-acting but have harmful side effects. Use them only as needed and for as short a time as is prudent. All right. So using herbs safely. Use one herb at a time. Learn about each plant from several sources. Avoid herbs and capsules. Really? Because I know a bunch of people that take herbs and grind them up and then put them in capsules. Okay. Avoid herbs and capsules. Respect the power of the plants. Those strong enough to act as medicines affect the body and spirit in powerful ways. Remember, every plant, person, and situation is unique. Excuse me. So your nourishing herbs are the safest. Side effects are rare. You brew in water or vinegar. Take in quantity for extended periods of time. They offer high levels of protein, minerals, vitamins, and antioxidants. Excuse me. Nourishing herbs are safe to take with drugs. Nourishing herbs in this book include chickweed, comfrey leaf, corn silk, dandelion, hawthorn, kelp, linden, mallow, mullein. Now, some of these I don't know if I'm pronouncing right because they're new to me. Mullein, Mullein, mullein. That's how we're going to say it. Mullein, nettle, oat straw, parsley leaf, plantain, purslane, red clover, raspberry leaf, self-heal, and slippery elm. So I would suggest those of you that are following this to study, keeping a journal of some sort, writing down these different names, researching the herbs, and things that you know about them. I know I have a few other books that's just all about herbs, so getting you some different herb books and studying them. These are just good things to know, you know. So tonic herbs, those were nourishing herbs. Now, tonic herbs act slowly and have cumulative effects. They are best used consistently for months or years. Tonics are safe to take with drugs. You prepare in water, vinegar, and alcohol, tinctures. Soothing tonics are used in greater quantity. Astragalus, burdock root, calendula, cleavers. I know this one. Echinacea, Eleuthero, fenugreek seeds, goldenrod, and passion flower. Bitter tonics aid digestion too. Buchu, dandelion root, cronewort, eleuthero, fennel seed, ginseng, American, milk thistle, motherwort, saw, palmetto, tea, black and green, vitex, wild yam, and yellow dock. Astringent tonics are often used externally. American ash, aspen, avens, barberry, bistort, black haw, coctus, cransbill, couch grass, horsetail, oak bark, Oregon grape, shepherd's purse, tormental, and witch hazel. Food tonics include turmeric, garlic, ginger, maitake, pomegranate, seaweeds, and wild mushrooms. Stimulating / sedating herbs act quickly and have powerful effects and side effects. They are used in the smallest effective dose and only for as long as is needed. They are problematic when combined with drugs. Daily use of stimulating / sedating herbs can undermine health. Stimulating / sedating herbs are used most often as tinctures. Stimulating / sedating herbs in this book: aloe, black cohosh, catnip, cayenne, chamomile, cinnamon, cramp bark, damiana, dong quai, ginkgo, ginseng, oriental, gold thread, guarana, juniper berries, kava, lavender, lemon balm, licorice, mahjong, marijuana, osha, parsley juice, parsley root, skullcap, sassafras, sarsaparilla, St. John's wort. Is that supposed to be St. John's or St. John's? St. John's wort, sage, uva ursi, usnea, wild ginger, and yohimbak. Potentially poisonous herbs can cause severe side effects. They are unsafe to use with drugs. They are used in the smallest effective dose and only for as long as needed. Potentially poisonous herbs are usually prepared as tinctures. Potentially poisonous herbs in this book: American mandrake, black walnut hulls, which kind of threw me for a loop the first time I read that because I'm taking some detox pills and capsules from a brother, and black walnut hull is one of the ingredients listed. So I was like, oh shit. Black walnut hulls, bloodroot, blue flag, cascara, that was another one in there. Celandine, chaparral, cotton root bark, eastern white cedar, golden seal, horse chestnut, ivy, English, life root, mistletoe, myrrh, poke root, tea tree oil, thuja, and tobacco are all potentially poisonous herbs. So notes on homeopathic remedies. Dilutions are not given for the remedies listed in this book. Dosage range is from 10x to 1m, which I have no clue what that means. Dilution is 100 times at 10x and 1 million times at 1m. Yeah, I don't know. Hopefully she explains that further. I have no idea what 1x and 1m is supposed to represent. Yeah. In general, the greater the dilution, the stronger the remedy. Those who are very sensitive generally do better with higher dilutions. The lower dilutions are considered cruder in their actions. There is no cleansing crisis or healing crisis associated with proper use of homeopathic remedies. If your condition worsens, take an herbal remedy or seek help. The result of taking a homeopathic remedy should be remission of symptoms. In acute cases, this will happen quickly, often within hours. In chronic conditions, this will happen more slowly, sometimes over a few weeks. In general, one dose of the correct remedy will have the desired effect. Taking further doses is not useful. However, for chronic conditions, repetitions may be used. Homeopathic remedies work best when taken at least an hour before or after eating. Avoid all strong tasting, strong smelling drinks the day you take your remedy. All right. So I'm going to read, so that was like the intro and all of that. So I'm going to start. Let's see how much time I have. All right. I got about 40 more minutes before I have to get my day started. So part 1 is for everyone. And it's talking about the pelvic floor. And I'm just going to see how far into that I can go before I need to stop. Okay. So we got the pelvic floor and then we have the bladder. So my goal is to get through the pelvic floor. All right. Let's get into it. Part 1 for everyone. The pelvic floor. Look at this beautiful rendition of a vagina. I am the floor. I am the ground. I am the base of your pleasure. I am the foundation of your well-being. I am the road that rises to meet you. I am the hammock. I am the sling. I am the hands that hold. I am the cradle. I am the safety net. I separate this from that, above from below, upright from horizontal. I hold firm. I open. I keep it all inside. I usher it out. I am rich. I am well supplied. I have nerve endings in abundance. I throb with blood. I am a treasure. I am the setting of the jewels. I am flexible. I stretch and bounce back. I thrive on action. Stir me, pulse me, use me, ask of me, demand of me, keep me strong. I am the mystical figure 8. I am infinity. I am the Mobius, the Ouroboros. Ouroboros. Ouroboros, the endless loop. I am the lowest, the slowest, the most powerful. I am your first gear. I am the mover. I am the shaker. I wrap myself around your most intimate parts. I support you in my firmness. I am the pelvic floor. Let me look up that O word I was struggling with. Ouroboros. Ouroboros, a circular symbol depicting a snake, or less commonly a dragon, swallowing its tail as an emblem of wholeness or infinity. Oh, okay. This right here. All right, learn something new. I am the mystical figure 8. I am infinity. I am the Mobius, the what? How you pronounce it? Ouroboros. Ouroboros, the endless loop. Okay, well, what's the Mobius? Mobius. Mobius symbol. The Mobius loop is the unfamiliar name of a very familiar symbol, a triangle composed of 3 arrows looping back on themselves in clockwise direction. This symbol indicates that a product can be recycled, but not necessarily that it has been itself produced from recycled materials. Okay. Mobius and Urubus. I'm learning something new. All right, pelvic floor. I love that. And this is when they speak of infinity. So pretty much what I got from that is this is what some I think will call the root chakra. It is like our base. It is, unless the root starts in the foot. Let me not get into chakras because I don't know what I'm talking about. But it just seems like this is what grounds us. This is what holds us. This is what we need to take care of. And it does all it separates above from below. It holds things in. It ushers things out. It's throbbing with blood. It's our treasure. It's our sacred space. So we should take care of it, know how to take care of it. And let's get to learn about it. So, healthy pelvic floor. In a healthy, well-nourished person, the tissue of the pelvic floor are well lubricated and elastic. The muscles strongly counter the downward tug of gravity. The blood vessels readily allow the engorgement of sexual arousal. The nerves freely carry signals of pleasure and tell us in a timely fashion when we need to move our bowels or empty our bladder. The pelvic floor is a continuous network of connective tissues, tendons, ligaments, muscles, and fascia that protect the bladder, rectum, and uterus. It has 2 opposing functions: to keep the organs inside the body and to provide their contents, urine, feces, babies, with a way out. Okay, in order to do both things, the pelvic floor must be tough and flexible. There are 2 sets of muscles in the pelvic floor: a deep layer, the pelvic diagram 1. Okay, so let me show y'all these. It's lighting. I gotta do better. Okay. So there are 2 sets of muscles in the pelvic floor: a deep layer, pelvic diagram figure 1, and a more surface layer, the perineum. Additionally, the pelvic side walls and the accessory muscles give pelvic support. In women, the muscular wall of the vagina helps strengthen the pelvic floor. The healthy uterus lies parallel to the pelvic floor, tilted away from the vagina toward the belly, causing a rounding there. A flat belly interferes with a woman's sexual health and wait a minute. A flat belly interferes with a woman's health and sexual pleasure. Now, wait a minute. There's a 1 at the end of that. So let me go to the back, because typically that means they are citing something, some source or something. And so I want to know what she means by that. Are you saying being slim or skinny is like not as good for your sexual health or pleasure? Bibliography. Let's see if I can find it. She has a lot of sources in the back. Okay. Yeah, here we go. All right. So in case you didn't know that, whenever an author has like a number or something, it's usually something referenced in the back to explain what she's talking about. All right, so end notes. So pelvic floor. Okay, so she put 1, and it doesn't go into details. She's just citing the source. So I guess that quote was from Lisa Sarasone, The Belly Book, New World Library, 2006. Okay. Dang. I was hoping this tell us something. So a flat belly interferes with a woman's health and sexual pleasure. Incidentally, during sexual arousal, the uterus stands up after orgasm, during which it vibrates. It returns to horizontal. That's interesting. All right. Standing upright puts severe stress on the pelvic floor. A group of muscles which is vertical in mammals with all 4 feet on the ground, but horizontal in humans. Gravity and the weight of the entire abdomen and upper body press down on the muscles of our pelvic floor. Pregnancy and obesity stretch the tendons and ligaments. It is no wonder that this is a problem area for many. Pelvic floor problems can arise from innate, functional, traumatic, or disease-related changes to the spine, pelvic bones, nerves, and blood vessels serving the pelvis. Aging, lack of exercise, and genetics are the most common causes of pelvic floor problems. The muscles on the pelvic floor, like other muscles, grow weak if not used. Exercising them regularly helps prevent and cure prolapse, incontinence, page 34. What's she talking about on page 34? What is incontinence? Okay. Stress incontinence affects half of those who leak. Weak pelvic floor muscles can't prevent leakage when there is a pressure from coughing, sneezing, laughing, exercising, or bending. Hereditary, childbearing, age, and surgery can weaken muscles. Herbs and pelvic floor exercises can strengthen them. Urge incontinence, overactive bladder. Causes avoiding urge so intense it is impossible to prevent leaks. It may be caused by muscle or nerve spasms, inflammation, chronic low-level bladder infections, an enlarged prostate, a fibroid tumor, uncontrolled diabetes, a stroke, even circulatory or neurological problems. Herbs and exercises can relax spasms, counter inflammation, eliminate infection, and ease prostate swelling. Okay, so the next half of the book will talk about incontinence and bladder, so I won't get into all of that, but she does mention it. So the muscles of the pelvic floor, like other muscles, grow weak if not used. Exercising them regularly helps prevent and cure prolapse, incontinence, and sexual difficulties. The sexual exercises for this area are called pelvic clenches or Kegels. She has a how-to about how to do Kegels on pages 10 and 14. Prolapses on page 6 occur when weak pelvic floor muscles allow the uterus, the bladder, cystocele, or the rectum, rectocele, to sag from their place in the pelvis down into the vagina. Goodness gracious. Chronic pelvic pain / CPP, page 15, affects both men and women. In men, it is often chronic non-bacterial prostasis. I don't think I'm saying that. Prostatitis is prostatitis. Bacterial prostatitis. Men and women are equally likely to have hemorrhoids, page 19, fistulas, and annual fissures, page 24. Here's a quote. The pelvic floor is important for maintaining a feeling of being carried, for the dialogue with gravity, and for our perception of the ground. It has an essential effect on our well-being and our vitality. Okay. Pelvic organ prolapses. Here's another one of those poetry quotes. I sense that you want my comfort. Grandmother Grove's voice softly echoes, but you must stand on your own now, dear one. You look dejected. beaten down, despairing, sinking. Pull yourself up by your bootstraps or pelvic floor ligaments, if you will, my child. Stop drooping and looking for sympathy. Clench your muscles. Feed your fire. Stand your ground. Put your heels on the ground. Let your belly come forward. Tuck your tailbone. Head up. Back straight. Be proud, growls Grandfather Growth. No one else can do this for you. You must find your own fierceness. Awaken your root chakra and create your own ground. Find your power. Be regal. Be proud. I love you. Step 1, collect information. If the uterus, bladder, urethra, or rectum protrude into the vagina, a variety of symptoms can be present in the belly or pelvic area. Tenderness, heaviness, dull pain, difficulty urinating, difficulty defecating, leakage of urine or feces, and or intercourse pain. More than 10% of American women have some degree of prolapse. More than 250,000 repair surgeries are done yearly, but surgical remedies may create worse problems. There are effective, simple, safe, wise woman ways to deal with prolapses without the risk of surgery. The pubococcygeal or the PC muscle is one of the major muscles on the pelvic floor. It starts at the pubic bone, wraps around the openings of the urethra, vagina, and anus in a figure 8, and ends at the coccyx. I don't know if I'm saying these words right. Coccyx, also known as the tailbone. The PC, which is the pubococcygeal. The PC is responsible for the contractions of orgasm. The stronger your PC, the stronger and more prolonged your orgasms will be. The PC also helps the bladder hold urine in. If it is weak, accidents are likely. Pelvic floor exercises strengthen and tone the PC muscles. Bladder prolapse is usually due to a weak pelvic floor, but sometimes removing the uterus, hysterectomy, allows the bladder to fall backwards and down. When it bulges into the vagina, it is a cystocele. If only the urethra prolapses, it is a urethral. Both can be mildly annoying to utterly debilitating. Surgery may worsen these problems. Prolapse of the bladder can stretch the uterus and lead to kidney problems. Protect the kidneys by drinking nettle infusion. Step 2, engage the energy. So step 1 was collect information. We are on pelvic organ prolapses. Step 2 is engage the energy. Prolapse is associated with helplessness and despair, as in, I've got a sinking feeling. It may indicate a need to escape from difficulties, to sink out of sight. Instead, get in touch with your Earth Mother Bitch Goddess. Affirm, I am rising up. I want to make a quick note right there. So I've been learning through my studies that, especially in the African context, we did not separate anything. So whereas in America you have the mind going to the psych ward, the body going to the hospital, and the spirit going to the church, in Africa or in ancestral times, all of these things were connected. So if something was off in your spirit, it probably affected you in your body and your mind. If something was off in your mind, it affected your body and your spirit. So they all tie in together. So that's kind of what that is. So if that sounded kind of out of whack to you, like what does me prolapsing have to do with me being stressed? That's why. Things that are affecting us mentally and externally affects us inside our bodies, which is why it's important for us to not deal with a lot of stress, learn how to de-stress, learn how to relax, learn how to listen to our bodies, and then taking time to study and learn how to heal it, right? So I'll read that again. Prolapse is associated with helplessness and despair, as in, I've got a sinking feeling. It may indicate a need to escape from difficulties, to sink out of sight. Instead, get in touch with your Earth Mother Bitch Goddess. Affirm, I am rising up. A folk remedy from China calls for rubbing the very top of the head with a tiny bit of castor oil to counter the outflow of energy which is causing the prolapse. Energy is stored in the pelvis, and organs prolapse when we use up our reserves and start to leak. Homeopathic remedies for prolapses are best taken in very high doses with the oversight of an experienced homeopath. Belladonna is a uterus-laden, falling, vagina hot and dry. Calc carb, uterus chilly, flabby, constipation. Lilium, anxiety, itchy vulva, urgent desire to pass stool. Natrum myrrh, uterus heavy, bearing down, better sitting. Nux vomica, sharp pains, constant urge to void. Pulsatilla, weepiness, nausea, pain in lower back and abdomen, worse with menses. Sepia, uterus draggy, taut, sex painful, depression. Step 3, nourish and tonify. A toned pelvic floor holds the orgasms up. The best way to tone the pelvic floor is to exercise it. Pioneering Dr. Kegel gave his name to the exercises he found so helpful. He believed that early morning exercises were especially important, for the patient begins the day with the perineum in a high position, whereas previously she started out with a sagging pelvic floor and considered the associated tired feeling normal. To counter any kind of prolapse, the tendons and ligaments of the pelvic floor need to be strengthened, not just the muscles. My favorite herb to nourish and tonify connective tissues is comfrey leaf infusion, a quart or more a week, drunk hot or cold. If you are reluctant to drink comfrey, use it as a sitz bath. The Family Physician by W. Beach, an herbal published in 1834, advises women with prolapses to use a strong decoction of witch hazel vaginally to tighten, tone, and pull up the pelvic organs. For strongest effect, sit in at least 2 quarts of witch hazel infusion and use your pelvic floor muscles to swoosh the liquid in and out of your vagina. Oak bark infusion may be substituted, as can black tea or comfrey leaf. The prostate herb, saw palmetto, is a deep nourisher of all pelvic tissues. A dose of 10 to 30 drops of tincture, taken 1 to 3 times a day, gradually strengthens the pelvic floor, pulls prolapses up, increases beneficial hormone responses, and counters incontinence. Okay. Help. She got a little thing on the side. Help. Pelvic organ prolapse. Expect results within 3 to 6 months. Commit yourself to 1 orgasm and or 100 Kegels a day. Experiment with saw palmetto or black cohosh tincture. Do an incline pose daily. Sits back. Dude, she got all these words that are in bold. So I guess she got the definitions of them in the back. Like a little dictionary or something. Let's see. Yes, she does. Okay. So I'm going to look up some of these things that she has in bold because I've been the glossary. All right. So real quick. Orgasm she defines as okay, it's in bold, but it ain't back here. Maybe she forgot it. A few of these words she got in bold ain't back here in the glossary. Okay, then, never mind. Well, anyways, experiments with saw palmetto or black cohosh tincture. Do an inclined pose daily. That's really why I was looking back here to see what an inclined pose is. Nope, not in here. Sits bath in oak, comfrey leaf, or witch hazel 3 to 6 times a week. Consider a Pessary or a sponge. Now, come on. Pessary got to be in there. What is that? I'm sorry, y'all. I was trying to be... Okay, so Pessary is a device placed inside the vagina to counter prolapse and keep the uterus in place. Also, a suppository of medication that is inserted into the vagina. Okay. Consider that or a sponge. A sitz bath is a bath for down there. Okay, so some words she got it defined in bold, some don't. Gravity can return pelvic. Hold on. Let me go back. So it's, okay, tincture of black cohosh root, a dropper full a day for 3 months, is a superb tonic to weak pelvic floor muscles and counter to all prolapses. Gravity can return pelvic organs to their intended places. You don't have to stand on your head or hang in a frame either. Even those with reflux problems can do many of these simple inversions. Inclined poses may seem too simple to be effective, but they have saved many women from surgery. Consistency brings the best result. When she say inclined poses, I assume she means like yoga, although she is not defining it back here. Lie on your back on the floor and prop your legs up against the wall at a right angle to your body, or sit the wrong way on a sofa or armchair with your back on the seat and your legs on the back, head hanging down. Rest in this position for 15 minutes. Lie on your back, hold your knees close to your chest, gently rock from side to side, or make circles with your hips on the floor. Continue for 5 minutes. Kneel on the mat. So these are the inclined poses. Kneel on the mat. Place your forearms from elbows to hands flat on the floor. Bend forward so your head touches the floor between your hands. Your bottom will go up. Rest there. Then between your hands. Then slide your hands forward and your knees a little apart to push your bottom further up. Rest for a minute or two. Lie on your back with your knees bent and feet close to your bottom, arms at your side. Pull your PC muscles up and in as you raise your belly toward the ceiling. Imagine a thread pulling the tailbone up. Hold for a count of 3. Release, rest, repeat up to 10 times. Yeah, these are definitely yoga exercises. Lie on your back, bend one knee, lift the other leg up 10 times. Rest, switch legs. Rest in an easy pose. Do you do yoga? Downward facing dog, camel, plow, and shoulder stand help the pelvic floor. Rest when done. Sitting upright and cross-legged makes the pelvic muscles do their part to keep you upright. It may be difficult at first. Persist. You'll not only relieve the prolapse, you'll enjoy deeper breathing, gain mental clarity, and have lots more energy. Sitting on a chair, pull your feet up and sit cross-legged on the seat. Oh, is that why in Eastern countries they always be sitting cross-legged? Dr. Kegel says before arising, contract the PC muscles 5 times. When you stand, contract the PC muscles another 5 times. Keep your PC muscles contracted as you walk to the toilet. Do 5 PC contractions every 30 minutes while awake. Unsure? Do a Kegel while urinated. It will block the flow. Okay. If your bladder is prolapsed, it is important to empty it completely at least once a day. To achieve this, undress, kneel over a pan on the floor, lean forward onto your hands, and pee into the pan. What? If your bladder is prolapsed, it is important to empty it completely at least once a day. To achieve this, undress, kneel over a pan on the floor, lean forward onto your hands, and pee into the pan. If your rectum is prolapsed, prop your feet up when you have a bowel movement. Unless you are acrobatic enough to balance on a toilet seat, use a stool and the same height as the toilet. Dance. Whether you go to a belly dance class or just groove to a beat at home, moving your pelvis strengthens your muscles. Do a Kegel exercise. Clench the entire pelvic floor, the vagina, anal sphincter, bladder sphincter, and PC. To strengthen fast twitch muscles that control the bladder, hold the clench for 2 seconds, then relax for 2 seconds. To strengthen the muscles involved in orgasm, hold the clench for 10 seconds, then relax for 10 seconds. For both, start with 10 repetitions, increase to 100. Pelvic floor clenches can be done anywhere, anytime. Do them while waiting in a queue. Do them while having intercourse. Do them while washing dishes. Do them now. Pelvic floor clenches, Kegels. Tighten and relax the pelvic floor muscles as quickly as you can 10 times. Do 10 repetitions. From my understanding, Kegels are like when you are tightening that muscle in the vagina, which I guess is the PC, like when you're trying to hold yourself from peeing. You know, you got to pee, but you holding it in, like just tightening that muscle. So tighten and relax the pelvic floor muscles as quickly as you can, 10 times. Do 10 repetitions. Tighten the pelvic floor muscles and hold for a count of 3. Then release. Do 10 repetitions. Slowly squeeze the pelvic floor muscles while counting to 5. Harder, harder, harder. Slowly release while counting to 5. Do the whole thing 10 times. Keep the buttocks, thighs, and belly loose. To be sure you are contracting the PC, put your finger in your vagina and feel the squeeze. Step 4, stimulate/sedate. So after struggling with the ups and downs of pelvic floor weakness for several years, the day finally arrived when I realized I could no longer tolerate any constriction whatsoever around my torso. Tight jeans and waistbands literally squeezed my uterus out of my body. Bras, high underwear, tights, pantyhose, and skirts were no longer viable clothing options. While healing a prolapse, consider a Pessary. Most are donut shaped. What in the hell is a Pessary? Please be in the glossary. A Pessary is a device placed inside the vagina to counter prolapse and keep the uterus in place. I read that already. Also a suppository or medication that is inserted in the vagina. So this is what it looks like. Like a little donut. So while healing a prolapse, consider a Pessary. Most are donut-shaped devices which, inserted into the vagina, act as a stopper to keep the uterus and bladder from falling. A natural sea sponge may be used as a Pessary as well. A Pessary is recommended for women who refuse surgery, women who are deemed unfit for surgery, and those who want to wait and see if surgery can be avoided. Hopefully this is you. Pessaries of linen, wool, brass, cork, or sponge have been used for centuries. Modern medical-grade silicone ones come in several dozen sizes. It may take several tries to find the perfect size for you. If you can insert, remove, and care for a diaphragm, then you can be able to use a Pessary. Christine Kent, who used the Pessary for 7 years while healing her prolapse, believes surgical approaches predominate because medical professionals are taught that women aren't willing or able to care for a Pessary. So the current standard of care calls for a physician to place the Pessary in the vagina. The patient returns each month for the Pessary to be removed and cleaned. But leaving a Pessary in your vagina for that long can cause infections, open wounds, fistula, even cancer. I never slept with mine in, nor did I keep it in longer than 12 hours at a time, writes Miss Kent. Each time she removed the Pessary, she washed it immediately with mild soap and warm water and put it on a peroxide and put it on a clean towel to dry. Twice a week, she soaked it briefly in hydrogen peroxide using an overnight soak to remove menstrual blood. Her Pessary gave her instant relief from the pressure and drag in her belly, but it could interfere with urination, prevent voiding, or cause stress incontinence. Sometimes my Pessary was comfortable for hours on end, she said. Other times it would be propelled out of my vagina and no way could I get it to stay in. Like a brace or a crutch, the Pessary is a very important helper during the process of healing prolapse naturally. Instead of the usual Pessary, try a sea sponge. Page 250. It's lighter and easier to use, but just as effective. Acupuncture, by itself or in combination with herbal or homeopathic remedies, can be helpful in correcting prolapses. Heavy lifting can aggravate prolapse, as can very low sugars. The rhythmic contractions of orgasm, whether alone or with a partner, lift the pelvic organs, tone the pelvic muscles, and help reverse prolapses. Pull out the vibrator and snuggle up to your sweetie. Worried about penetration? No problem. Say the prolapse women I've met or whose stories I've read. No matter how weak the pelvic floor or how severe the prolapse, intercourse can be pleasurable. Prolapses are compounded by gravity. Lie down and the organs return to their proper positions. Step 5, use drugs. Because it is well known that statin use can weaken muscles, I believe it is impossible that the medication may have caused my prolapse. Recently, statins have been shown to cause actual structural damage to muscles in some people. Oh, okay. Statin, I guess it's a muscle. They're saying that this muscle actually made their muscles weaken and prolapse. So stay away from statin, I guess. Step 6, break and enter. Women suffering from pelvic organ prolapse should always attempt alternative treatments before having a hysterectomy. Despite the assurances of gynecological surgeons, women are often unhappy with the results of surgical fixes for prolapse. Pelvic floor surgeries are complicated and may lead to greater pain and weakness. A hysterectomy may change one distress for another. In any surgery, nerves are cut. In pelvic surgery, that means loss, for some women major, for others minor, of sexual sensation. Muscles are cut and sewn, adhesions form, there's often chronic stiffness, inflammation, and pain. Dr. Howard Kelly, one of the early founders of gynecological medicine and creator of many of the pelvic floor surgeries still in use today, proclaimed in 1900, "I do not believe pleasure in the sexual act has any particular bearing on the happiness of life." Yeah, dude. The removal of uterus and or ovaries is rarely justified to remedy prolapses. Seek a more compassionate caregiver and go back to the earlier remedies in this chapter. So her story. Christine tells her whole story in Saving the Whole Woman. When my gynecologist told me I needed immediate surgery to deal with a fibroid, he asked if I was ever incontinent. Yes, I admitted, but only occasionally. Let's look up incontinent for those that don't know. Definition of incontinent.
Here's the definition of incontinence. Having no or insufficient voluntary control over urination or defecation.
Okay. Lacking self-restraint, uncontrolled. All right. So when my gynecologist told me I need immediate surgery to deal with a fibroid, he asked if I was ever incontinent or unable to control urination or defecation. Yes, I admitted, but only occasionally. You're too young for that, he admonished. Since I'm going in there anyway, I'll get rid of that problem at the same time. Recovering from the surgery was uneventful, according to the doctor. My vomiting, extreme pain, and infections were normal, but a few weeks later, my uterus was down in my vagina. Prolapse was the diagnosis. I was told by every doctor I consulted that the only cure was a hysterectomy. If my uterus was a problem, then remove it. But surgery had caused the prolapse and left me numb down there. Sex no longer worked. My bowels were adversely affected. My entire body felt twisted. Who knew what further damage more surgery would create? I refused to lose my uterus. I saw alternatives. I pioneered Pessary use, making it up as I went along. There were no instructions for me to follow except the awesome truth of my own body. I learned to sit cross-legged, to stand from my center, to feed myself nourishing foods, to do yoga and pelvic floor exercises, to free my breasts and belly from elastic cinches, and to reconnect with and honor my own power. I went to chiropractors, massage therapists, nutritionists, anyone who could offer me a piece to fit into my healing puzzle. It took time. It was difficult. At its worst, my uterus was boggy and heavy and protruded an inch out of my vagina. Oh my. When I menstruated, the pain was excruciating. I could hardly stand, walk, or even sit up. Sometimes I bled and bled and bled. Hysterectomy lurked, beckoning me the easy way out. It took courage and faith in myself as well as time to revitalize my pelvic floor and heal my prolapse. I found my courage. I trusted myself and my body. I took the time I needed. I still have my uterus. It sits up in my pelvis where it belongs. Some thoughts on pelvic floor exercises from Michelle Lyons, pelvic floor specialist. There are both slow twitch and fast twitch muscles in the pelvic floor. 70% of the total are slow twitch muscles. They are the marathoners. They maintain pelvic floor integrity most of the time. 30% are fast twitch muscles. They are the sprinters. They come into play when there are high intra-abdominal pressure events such as coughing, sneezing, or jumping. It is important to exercise both the slow and the fast twitch muscles, but it is even more important to relax all the pelvic floor muscles completely. If we do the exercises and don't relax between reps, we can develop trigger points and spasms in the pelvic floor muscles. These spasms inflame hyperactivity in the nerves associated with chronic pelvic pain, low back pain, and pain with intercourse, or dyspareunia. We want to develop a full range of motion from all the way relaxed to maximally contracted and back to relaxed. This is what gives us control. To relax, breathe into your belly. Feel the belly button move out and the pelvic floor open and drop. To find the right muscles, imagine trying to hold back a big stinky fart. To contract, breathe out and engage the muscles. Aim for a lift rather than a squeeze. Sucking your thumb helps. Breathe. Holding your breath can weaken the muscles or send them into spasms. Stand tall. Poor posture puts a terrible strain on the pelvic floor muscles. Let a strong back and a strong abdomen take some of the load off the pelvic floor. Okay, continue your pelvic floor education with Pelvic Power Mind/Body Exercises by Eric Franklin. All right, let's see. Do I have enough time to go into... I do not. Let's see if we can get through it. All right, so chronic pelvic pain. Put your belly on the warm sand, counsels Grandmother Growth. Give your pain to the earth. Spill your guts into her. Release your fear, your dread, your nightmares into the accepting, transformative earth. Cry into her. Cry out the pain of the millions of women who are oppressed, raped, cut. Cry out your personal pain. Empty your belly. Trust in the process, encourages Grandfather Growth. And when you are done, the fire in your belly will be yours. It will blaze your path instead of burning you alive. Step 0, do nothing. Relaxing deeply and breathing slowly, even for 15 minutes, is a powerful pain reliever for those with chronic pelvic pain. I have this saying that I post every morning on Facebook. Did you wake up, stretch, give thanks, drink water, go over your affirmations and goals, moisturize before getting online, before getting in your car, going to work, because you matter. Self-care is important. And it truly is. When you take that time to be intentional and just breathe and just be with you, especially at the start of your day, setting the tone for your day, it works wonders for you. And when you don't, you feel more scatterbrained. You run into certain things and you react emotionally because you ain't had that time to just take in and tune in. So I'm happy to see that just relaxing and breathing deeply helps with chronic pelvic pain. Many men struggling with CPP find any meditative practice immediately helpful. Hypnosis is rarely helpful. Step 1, collect information. Few medical conditions are as perplexing. At least 10 million American women are affected by chronic pelvic pain. CPP is defined as the American College of Obstetricians and Gynecologists as any pain anywhere in the pelvis that persists for at least 6 months and has no apparent cause. CPP symptoms: pain radiating from pelvis to lower back, hips, thighs, buttocks, pain when bladder is full, pain on sitting, menstrual-like cramps and aches, pain on intercourse, pain in the abdomen, prostate pain. Consider this: men who used to have chronic non-bacterial prostate. I gotta figure out how to pronounce this word. Prostatitis? No. Prostatitis. How you pronounce that? Prostatitis. Inflammation of the prostate gland. Okay, so consider this: men who used to have chronic non-bacterial prostatitis now have CPP. Half of all women with CPP have endometriosis. For all men, CPP is deeply linked to trauma. Down there's can become sensitized to frequently used soaps, detergents, fabric softeners, perfumes, and spermicides, leading to itching, burning, and painful intercourse, but not CPP. Pain during intercourse is a symptom of CPP, but prostate, bladder, and uterine infections, hormonal changes, pelvic tumors, and cysts, trauma, prolapses, venereal warts, herpes, outbreaks, yeast, and other STDs can also interfere with pleasure. Women with CPP say their pain follows the menstrual cycle, flaring up in intensity with the menstrual flow, then easing off for a few weeks. Men don't seem to have cycles with their CPP. The suspected origin of CPP is a bundle of nerves at the base of the spinal cord, the superior hypogastric plexus. These nerves relay pain sensations from the pelvis to the brain. When they are chronically stimulated, the signals reverse and the brain sends pain signals to the pelvic muscles. Eventually, these healthy areas respond with painful spasms called pelvic floor tension malacia. Structural problems abet this nerve disruption. Yoga relieves them all. It realigns the sacroiliac joint, strengthens the muscles of the pelvic floor and abdomen, and restores elasticity to the stretched ligaments. Up to 2/3 of those affected by CPP don't get a proper diagnosis. Desperate for relief after years of pain, many agree to surgery, which can make the pain far worse. Help chronic pelvic pain. Expect results within 2 to 4 months. Take 2 to 4 dropperfuls of St. John's wort tincture daily. Commit to 4 to 6 acupuncture or massage sessions. Take a course in relaxation. Drink 3 to 6 quarts of nourishing herbal infusion weekly. Okay, so step 2, engage the energy. The belly is the pelvis. The pelvis is the hara. The hara is the center of the body. The belly is an important part of the immune system. It can remember just like the brain. Chronic pelvic pain is a message from your center that you don't feel safe in your life/body. Whether dealing with acute or chronic pain, I especially like Stephen Levine's Meditations on Pain in his book, Who Dies? Step 3, nourish and tonify. Whole body massage or electromagnetic therapy relaxes the pelvic muscles and normalizes nerves. Weekly sessions are best until the pain is under control. Nourishing herbal infusions, a quart a week each of oat straw, comfrey, and linden calm nerves, ease muscle spasms, and help reproduce pain from adhesions. Since all seed oils are high in omega-6 fatty acids, which are inflammatory. Reducing or eliminating seed oils from the diet can bring rapid relief from inflammatory pain. Instead, use olive oil, a natural anti-inflammatory, or butter, an active pain reliever. A physical therapist can design an individual program to help you relieve your pain. Find one at www.womenshealthapta.org. Hot compress of comfrey leaf, castor oil, plantain oil, or calendula oil applied to the belly can ease pain and gently but slowly dissolve adhesions. Patience and persistence pay dividends. Aim for 4 to 7 applications a week. Step 4, stimulate/sedate. Acupuncture successfully reverses the nerve disruption, muscle spasms, and myalgic pain of CPP. Ultrasound, electrotherapy, and biofeedback are useful for some woe/men. Static magnetic field therapy or magnet therapy used continuously for a month significantly reduced chronic pelvic pain in a small double-blind study. I prefer herbal painkillers such as skullcap or passion flower tincture and meadow sweet oil and herbal muscle relaxers such as St. John's wort tincture. Not only are they effective, they are free from side effects and usually and dependably non-addictive. Step 5, use drugs. Non-steroidal anti-inflammatory drugs such as ibuprofen or aspirin ease pelvic pain. So do muscle relaxers, anticonvulsants, tricyclic antidepressants, anti-seizure meds, and opiates. Injections and the anesthetic lidocaine into tender pelvic or abdominal muscles can bring immediate but short-term relief, or they can cause the pain to be expressed in other places. Birth control pills are effective therapy for some women who suffer from CPP. Her story. Moonflower is a homesteader with 3 children. I assumed the debilitating pain I was suddenly feeling with my period meant there was something wrong down there. It took all of the best diagnostic tests that modern medicine could throw at me to convince me that I did not have fibroids, cysts, endometriosis, or worse. Things I never heard of. The iliopsoas muscle and the ilioinguinal nerve are at the root of my pain. There's no happy ending yet, but acupuncture and herbs have helped a lot. Step 6, break and enter. Orgasm or intravaginal/intrarectal massage counters pelvic floor spasms fast. Do it yourself or ask for help. All surgical procedures, including laparoscopies, leave scar tissue adhesions in the soft pelvic tissues and cause nerve damage, both of which may trigger CPP. Paradoxically, surgery to remove the adhesions is recommended for woe/men with CPP. This creates more scar tissue, more pain, more damage. CPP is responsible for 12% of all hysterectomies done in the USA, yet 1/4 of these women get no relief. CPP is also responsible for 40% of the laparoscopic procedures done in the USA, but even when a supposed cause is found and treated, many women continue to suffer pelvic pain. The ultimate solution for women with CPP is to cut the nerves in the lower back, thus preventing pelvic nerve signals from being transmuted. Strangely, this does not always work. All right, so I have to go. I'm about 4-5 pages away from the next segment, which is the bladder. So I will come back. We're still in the pelvic floor. The next section is hemorrhoids. So I will come back with that. Thank you for tuning in. Okay, and I'm back to finish up the chapter on the pelvic floor. We stopped at hemorrhoids. "You are so fragile, my precious grandchild," murmurs Grandmother Growth. "But being tense and fearful will not compensate for fragility. In fact, your tension makes you more easily damaged. You can't keep yourself together. You've lost the will to push against obstacles, but life doesn't play fair. It doesn't stop if you give in. It keeps on moving through you, fast and furious," hisses Grandfather Growth. "The life force, the chi of all you ingest is absorbed through the blood vessels of your large intestine. You need vigorous veins in your pelvic floor. You want pushy veins, not loose, relaxed, laid back veins. There's a difference between being easy and being slack. Let us look for and nourish your flexible strength. It's becoming impossible to sit on it, isn't it?" Their laughter spills through the twilight, sparkling like fireflies. Step 0. Do nothing. Not everyone with hemorrhoids has symptoms, and hemorrhoids should be treated only if they are bothering you. Step 1. Collect information. Hemorrhoids are inflamed and enlarged veins in the rectum and anus. Half of people over 50 have them. They may cause symptoms or not. If they do, they are the original pain in the ass. Hemorrhoid is from Greek hemo, blood, and rous, flowing discharge. They are also called piles, from the Latin pila, a ball. Hemorrhoids may stay internal or push out of the anus. They may itch, bleed, or cause intensive pelvic pressure and pain. External hemorrhoids may fill with blood and form hard, walnut-sized, bluish lumps, thrombosis, around the anus. They are often quite painful and itchy, but generally dissipate on their own. Internal hemorrhoids may bleed bright red blood. Blood from colon cancer is usually dark red. They are often painless, but may prolapse out of the rectum and cause pain or itching. What causes hemorrhoids? Pressure in the anal/abdominal area, genetics, a tense pelvic floor, a weak pelvic floor, constipation, diarrhea, pregnancy, vaginal birth, obesity, chemotherapy, radiation treatments, and sitting for long periods. About 75% of Americans have hemorrhoids. It's not a hemorrhoid if you are in constant pain or bleeding persists. You may have a fissure or a fistula. Step 2, engage the energy. Visualize aqua light cooling and soothing the anus. Let it tighten loose tissues, ease irritation, and bring a smile to your face. If you are so inclined, imagine a hum passing through the anal blood vessels. Feel the vibration bringing healing and support. Homeopathic remedies for those with hemorrhoids. Acelus, rectum very dry, hemorrhoids swollen, blue-purple, worse with standing. Aloe, hemorrhoids like grapes, better with cold water. Ignatia, severe rectal spasms, cutting pains, anal fissures. Hamamelis, large, blue, sore, congested, bruised feeling, bleeding, hemorrhoids, worse in pregnancy. Nux vomica, congested, painful, better after stool. Ratanhia, severe pain, burning, cuts like broken glass, worse after stool or with touch. Sepia, heaviness, prolapse, worse in pregnancy. Sulfur, moist, large, hot, congested hemorrhoids with severe itching, worse at night with standing. The homeopathic supplier Boric and Taffel offers alpha hemorrhoids, a combination of horse chestnut, witch hazel, nux vomica, and sulfur in a suppository to relieve pain and itching. Step 3, Nourish and Tonify. The same things that ease constipation, ease hemorrhoids: water, fiber, exercise, and going to the toilet at set times. Ease hemorrhoids by drinking up to 2 quarts of herbal teas or infusions daily. Astringents like black or green tea, raspberry tea, or comfrey leaf infusion shrink hemorrhoids and counter bleeding. Soothers such as linden infusion, marshmallow tea, or slippery elm mixed with honey relieve pain. Nettle infusion restores youthful elasticity and tone to the anal veins. Aim for 10 servings, 25 to 30 grams of fiber-rich foods daily. Whole grains, beans, nuts, fruits, and vegetables, or supplement with soothing flax or plantain seeds / husks cooked in oatmeal or soaked in cold water overnight. Compared to a placebo, fiber reduced symptoms by 47% and bleeding by 50%. Exercise that moves the lower body: swimming, walking, dancing, jogging, pelvic floor clenches helps. Constipated, avoid laxatives, enemas, and colonics. They worsen hemorrhoids. A dropperful of yellow dock tincture moves things along without stimulation. Step 4, to ease itching quickly, apply a poultice of freshly chewed plantain leaves or calendula or plantain ointment. Help hemorrhoids. Expect results immediately. Apply witch hazel liquid. Apply plantain oil. Avoid peppers, chilies, curries. Expect results within 3 to 6 weeks. Every week, sit in a quart of astringent herb like oak bark and drink a quart of soothing herb like linden. Take 2 dropperfuls of stoner root tincture daily. Increase fiber and fluids. Alternating hot and cold sitz baths soothe pain, reduce swelling, and counter itching, stop bleeding, and shrink hemorrhoids. Use plain water or add seaweed or aloe juice, or try alternating cold oak bark and hot comfrey sitz baths. Witch hazel, a small tree native to North America, is everybody's favorite hemorrhoid remedy. You can buy witch hazel at the drugstore in a bottle or in pre-moistened towelettes to use instead of toilet paper. Soak a cotton ball in the witch hazel and apply to the painful area. For cooling relief, keep it in the freezer. It rapidly shrinks swelling, eases pain, counters bleeding, stops itching, soothes irritation, and encourages healing. A witch hazel bark sitz bath is even stronger. Sitting Pretty Salve lives up to its name. Chilled, and she tells you how to make it later on in the book. Chilled horse chestnut gel shrinks hemorrhoids fast. Herbalist Christopher Hobbs calls stone root the premier hemorrhoid herb. It's miraculous. He suggests 2 375 milligram capsules of the powdered root twice a day with a full glass of water between meals. Herbalist David Winston prefers tincture of the whole fresh plant, a dropperful twice a day. Some herbalists apply tinctures externally too. Naturopath Mark Stingler uses 200 to 300 milligrams of butcher's broom, standardized to 9 to 11% ruscogenins per day to control bleeding and pain from hemorrhoids. A daily dose of 320 milligrams bilberry extract, 25% anthocyanins, strengthens blood vessels, walls, improves circulations, and shrinks hemorrhoids. Step 5, use drugs. Caution: typical topical creams like Preparation H and Anusol, anesthetic creams, names in cane, and 0.5% hydrocortisone cream can injure skin and damage perineal and anal tissues if used for more than a week. Instead, soothe with cool yogurt, plain cocoa butter, or zinc oxide paste. Step 6, break and enter. No surgery, and especially not hemorrhoid surgery, is pain-free and without potential complications. If there is continued bleeding, uncontrollable pain, or prolapsed hemorrhoids, and if dietary changes and herb sitz baths haven't worked, there are invasive, aggressive treatments. Rubber band litigation cuts off the circulation to the hemorrhoid, causing it to fall off with little or no pain, though there may be bleeding or infection. Lancing a clot in a hemorrhoid brings fast relief. Lasers, electricity, or infrared energy seal off or vaporize the affected blood vessels, but there is a high recurrence rate. How do you pronounce this? Sclerotherapy is less expensive, less painful, and less effective than ligation. Chemicals injected into internal hemorrhoids destroy them. Side effects include abscess formation, fecal incontinence, scarring, and infection. Cryosurgery freezes hemorrhoidal tissue. The Kegel technique, or hemorrhoidulasis. These words. Hemorrhoidolasis. Hemorrhoidulasis is an outpatient procedure requiring 6 to 10 sessions. An electrode conducts a current into the hemorrhoid, causing it to shrink. Large prolapsed internal hemorrhoids may need to be surgically removed. This is hemorrhoidectomy. Post-surgical pain is a major problem requiring weeks of strong medications. A new outpatient procedure, PPH, or hemorrhoidectomy, uses a circular device to lift hemorrhoids and staple them into their original position above the area of nerves. Hemorrhoids are pulled back into the anal canal, not removed, which minimizes fecal incontinence and stricture after surgery. The anal area is rich in nerves, so traditional surgery to exercise hemorrhoids leaves patients in considerable pain. Anal fissure, anal fistula. So we're done with hemorrhoids. Now we're on to anal fissure and anal fistula. You are being ripped in two, weeps grandfather growth. Torn asunder, thunders grandmother growth. Split from stem to stern, hooked and gutted like a fish. What horrible thing have you tried to consume that grappled you as it passed? Wonders grandfather growth. Have you bitten off more than you can chew? Is it eating at you from the inside? Admonishes grandmother growth. Stop sitting on it, they yell at the top of their lungs. You vibrate. Step 1. There is no step, mind you, there is no step 0, do nothing. Okay, so it starts immediately with step 1, collect information. An anal fissure is a tear in the lining of the anal canal that will not heal. Fissures are intensely painful and bleed profusely. Fissures don't heal because they trigger spasms in the underlying sphincter muscle that continually re-injure the tear. An anal fistula is a tear that continues through into the vagina or vulva. Because it is in contact with feces, a fistula does not heal. Step 2, engage the energy. Is something tearing you up inside? Are your guts in knot? Is someone knifing you in the back? Are you in the hot seat? Do you have an itch you can't scratch? Are you getting it up the arse? Can you change it? Can it change? Sorry. Help, anal fissure, fistula. Expect with results within 3 to 6 days. Drink 2 to 3 quarts of comfrey leaf infusion a week. Comfrey leaf sound like it heal everything. Apply aloe vera or horse chestnut gel. Try oak bark sitz baths. Take stone root, horse chestnut, or echinacea tincture. Step 3, nourish and tonify. Comfrey leaf infusion. Internally and externally strengthens the anal tissues, initiates rapid healing of fissures, calm fistulas, and relieves spasms. Frequent sitz baths soothe, tighten, and mend anal tissues. Frequent sips, hot with honey, strengthen the intestine throughout, helping them resist further fissures. Increase hydration, fiber, and exercise to counter fissures, and eat slippery elm. This high-fiber herb repairs, nourishes, and soothes digestive tissues. The powder can be cooked in hot cereal or mixed with honey and slowly dissolved in the mouth. Apply aloe vera or horse chestnut gel to the fissure as often as possible or whenever there is pain. Step 4, stimulate/sedate. Oak bark sitz bath heals anal fissures, genital inflammation, and hemorrhoids. Is antiseptic and antibacterial too. A combination of echinacea and golden seal tinctures applied directly to the fissure or fistula will sting as it clears infection, tightens the tissues, and initiate rapid healing. This remedy from Russia gets to the root of the problem. Heat a brick in the oven until very dry. Place it in the bottom of a large metal bowl. Put some cloves of raw garlic on it. Remove your pants and squat over the bowl. The fumes from the smoldering garlic counter infection and prompt rapid healing. Interesting. Horse chestnut or stone root, used internally and externally, ease pain and helps initiate healing. Her story. Serenity channels angelic beings. I went to the doctor with a pain in my butt and I left bleeding and in need of surgery. I swear he split me in two when he put his finger up there to check things out. They cut out a piece of my anus. It still works fine, though my bowel movements are thinner now. Plum flower brand Formula H is a patented Chinese herbal remedy recommended by a woman who says it keeps her fistula under control, meaning it never gets big or discharges. Step 5B, use drugs. Ointments of nitroglycerin or a calcium channel blocker are effective 50 to 90% of the time for those with anal fissures. They move the pain from one end to the other, though, as both nitro more often give many people a splitting headache. Step 6, break and enter. Injections of Botox temporarily paralyze the internal anal sphincter muscle so the fissure can heal. Between 60 and 96% of patients note improvement. Temporary leakage of gas or stool is likely. Often only one shot is needed. As a last resort for a stubborn fissure that will not heal, a piece of the sphincter muscle is removed, the spasm stops, and healing commences. This causes fecal incontinence in up to 30% of patients. Her story. Lottie is a librarian in a major city. At first, I thought it was a pain from a hemorrhoid. I had a lot of pains in the butts going on, an abusive boss, and a difficult mother. The first doctor said it was a fissure. The next wanted to do invasive tests. The third was ready to wheel me into surgery. It was all very discouraging and wore me out. I decided my body was helping me express and understand how badly ripped up I had become. I committed to a year-long process of healing my digestive tract. I used yellow dock root, dandelion root, and slippery elm powder internally. Plantain and comfrey leaf oil externally kept me pain-free. Though at times I felt sure the fissure was getting worse, it did finally resolve after a year. I've been fissure-free and pain-free for 6 years now. I couldn't have done it without the love and support of my herbal and witchy friends. Pelvic Floor Star, Fenugreek. Fenugreek is an annual plant in the bean family. The nutritive and soothing qualities of the seeds have made them a pelvic floor star from the time of Dioscorides to today. A tea of the pleasant tasting seeds is made by steeping a tablespoonful in a pint of boiling water for no more than 10 minutes. The strained liquid may be taken hot with honey or chilled. Frequent use of fenugreek seed tea eases irritation throughout the pelvic floor and pelvic organs. It relieves hemorrhoids and chronic pelvic pain in both women and men. It restores moisture to dry vaginal tissues and eases menstrual pain. It increases the nutrition in and the amount of breast milk. Fenugreek was the main ingredient in Lydia Pinkham's vegetable compound. Fenugreek seeds are rich in iron, lysine, and tryptophan. The seed oil used externally is said to resolve fissures quickly. Pelvic floor star, horse chestnut. Horse chestnut is a large tree found throughout the temperate regions. Its primary use is as a prepared topical gel to shrink hemorrhoids and heal anal fissures. Internal use may cause problems. Horse chestnut is a specific against chronic venous insufficiency. Placebo-controlled trials, including one restricted to pregnant women, confirm its ability to counter inflammation and tighten veins. It also relieves nocturnal leg cramps, phlebitis, rheumatism, neuralgia, and bruises, and hastens recovery after surgery. Horse chestnut contains acin, which reduces the permeability of blood vessels, plus tannins and quercetin, which counter pain and swelling. There are no side effects with proper administration of designated therapeutic dosages. A cup a day of the leaf tea, 30 drops twice a day of seed tincture, or 4 seed extract caps a day are considered safe dosages. Cautions. Internal use of horse chestnut can redden urine. It thins the blood. Do not take with aspirin or Coumadin. Susceptible patients may experience irritation of the gastrointestinal tract or decrease in kidney function. Good Lord. All right, well, that is the end of the first section of part 1 for everyone, the pelvic floor, and the next section will be the bladder. So I'll be back with that at another time. Thank you for tuning in.